Welcome to the Operatory podcast, the podcast about burying the dinosaurs in dentistry, moving past outdated technology and procedures to find a better way. With me, as always, providing the very key patient perspective, the perspective from the other side of the chair, David Pryor. How are you doing, sir?
The only one in the chair.
The only one in the chair.
Well,
you're right.
You're sitting down, I guess. But
yeah, but you're in the chair, not a chair.
The chair, yes.
Yes, I'm in a chair.
Yeah.
The assistant or hygienist is in a chair.
Yeah.
You, my friend.
All right. I'm in the chair.
The chair. The chair, yes. And today we have a very important topic.
Okay, hit me.
It is how to get new patients.
Yeah, well, that would be an important topic right now.
Yes, I like to say that, especially right now, like you said, after the pandemic, I don't know if I was not after, in the midst of this pandemic, after the shutdown, maybe shutdown number one, hopefully, and only the one and only shutdown. There has been a lot of shifting of team members, shifting of people, shifting of patients, and there's a lot of, I think, issues in the average dental practice right now. Mm-hmm. And I heard something a long time ago that I believe is very true. It's been a mantra of mine for a long time, and I think it's incredibly important right now, and that is there's not many practice management issues that a steady stream of new patients can't fix.
That makes total sense.
Yes. I mean, whatever's going on in your practice, next, right? And new people coming in, and you can overcome a lot of problems. I'm not saying I firmly believe that your existing patients are the most important patients. Yeah. The best new patients are referrals from existing patients, right? Yep. So my number one tip is going to be to focus on the people that you have. Listen to all the podcasts, put everything in place, elevate your game, to bury those dinosaurs in your practice so that you can get the best experience for your existing patients so that they refer others. That's the best way to get new patients, right? Sure. Yeah. And we always say, whenever you get a compliment, ask for a referral, right? So my friend, now this is like the best technique I've used to swindle you, right? Are you ready?
Okay.
Not the best. Maybe the second best. There was another podcast that was funny, but
swindle me.
All right. So pay me a compliment, my friend. And pretend this is what we're so good. Pretending like you just came in to see me as a patient. Pay me a compliment. I set this whole up just so I could get a compliment. It makes me feel good. I've been out today, Dave, so pay me a compliment.
Well, your new beard makes you look so much younger, Brian.
Well, thank you, Dave. And you know what? We love seeing patients like you. So if you know somebody like yourself who's funny and really appreciates a good beard, we would love to see them in our practice. But I think that's it makes a good point, right? When someone pays you a compliment, then you can compliment them back and ask for a referral. It's the best way, and really what it's that whole principle of reciprocity. When you've done something for somebody and they feel good about it, they're going to want to tell somebody at that moment in time, right? Sure. So my number one tip to get that steady stream of new patients is to ask for a referral authentically whenever you get a compliment from a patient. Sure. Now, again, make sure it's a patient you like, because birds of a feather tend to flock together. If you don't like the patient, if they're that PIA patient, right? Yeah. Oh, thanks for the compliment. Have a nice day. But if you do like them, if they compliment you on your beard and you like them, then ask for a referral. Thanks for the compliment, Dave. You went beyond dentistry to my appearance. I appreciate that. Thank you. So the number two way to get a steady stream of new patients is to automate your reviews.
Sure. Yep.
Right? So if you can't ask for a referral at that moment in time, or even if you do, frankly, making it so that you are consistently asking people to leave you a review is vitally important, because there's two big things that people look at reviews. So think about it. If you go to buy something from Amazon, let's say you're buying a new thermos, right? You're going to look at two things when looking at the little stars. Number one, the rating. Mm-hmm. Number two, the number of ratings, right? So I think everybody listening to this podcast probably does the same thing too, right?
Yeah, for sure.
You see, it's got 5 stars. it has 2 5 stars.
Right.
Right?
Yep.
No good.
Yep.
Right? So you need to have a lot of reviews. And so automating that with a system that goes directly to the 2 big ones, Google and Facebook, is most important. Right? You know, there's a lot of review platforms out there, and we've talked about it on the podcast before, that they do what's called micrositing, where they have some fancy name for some website like Patient Super Hub Connect 5312.com, right? And then they say that they do SEO, right, to get you more reviews on their platform. Guess what? They're not doing more SEO than Google.
No, they are not. Or Facebook.
Or Facebook, yeah.
Right.
Because guess where they're searching in Facebook?
Facebook?
Facebook. Where are they? And by the way, where are they searching on Google?
Google?
Yes. Who's using Bing?
No one?
That's right. That's right. So you want to have a lot of Facebook and Google reviews, and the best way to do that is through
Google and Facebook?
That's right.
Oh, my
Yes.
God. This is the first on the podcast where I got all of Brian's questions right. Raise a flag, someone.
And it's because you complimented me so nicely.
Okay.
Thanks, Dave. So I'm giving you softballs.
Okay.
So make sure that you have a direct link. When somebody says, I want to leave you a review, it should say on Google or Facebook and go right there, right?
Yeah.
And then you obviously have the flip side of the positive reviews that get massive new patients, and that is the negative reviews.
Yes.
Right? 2 big things about negative reviews, right? First of all, I guess 3 things. Number 1, don't get them. Right?
Okay.
In large part, that comes down to financial arrangements, right? So making sure, because people don't usually complain about dentistry that's done well and paid for. So making sure that you have good financial arrangements will protect you, number 1.
So yeah. I want you to emphasize that, because it's really something that I think people can gloss over, but I think it's a big, big deal. And I think that if the patient knows, here's what you're getting, here's how much it's going to cost, and they are very clear on it on the front end, the negatives go away entirely.
Yep. I would have, when I was talking with associates, and then we talk about something like a small issue with a case that they did, maybe they did a bunch of veneers, I would ask, number 1, is it already paid for? Because if the answer was yes, then I know it's a real problem. If the answer was no, oftentimes it's the number 1 that's that is right. So
totally,
you're exactly right.
Yeah, and so I could tell you were just going to blast past it, and I'm like, no. This is important. It's really important information, and I think everybody should, because as a salesperson, it's really something that I make sure I'm very clear on. And people, we lose very few customers.
Oh yeah. No, you are 100% right to pause and reflect on that one comment.
Yep.
So again, to recap, to emphasize it,
Yep.
to reduce the number of your negative reviews, number 1 thing you can do is taking care of patients, right? And then by far the number 1 thing is making sure you have good financial arrangements. And that is not easy. It's hard in dentistry, right?
For sure.
So there's a lot to do in your practice to make sure that at the point of sale, when you're talking to a patient, that you have good financial arrangements. And it's very hard. You're right. That is not a step to skip over.
Right.
It's something very important.
Yep.
Number 2 is I believe equally important, and that is to make sure that you have a large number of positive reviews. Because if you do have a large number of positive reviews, it'll bury that every once in a while patient that, let's face it, if we're all showing up and we're all trying to do a good job for patients, if we're doing our best dentistry, and we are making good financial arrangements, the number of times that there's actually a negative response that people are going to negative feedback is very small, right? And if there is that negative feedback, usually they're going to want to let you know, or there's not something right going on up, 6 inches above their teeth.
Right.
And so those negative reviews, quite frankly, if you have 200 reviews and you have a 4.8, right?
Yeah.
People are going to look at those negative ones and go, there's something fishy, weird going on there. Everybody can have a bad day, patients or practice, right? So it gets buried. And in fact, it shows, I think, 200 reviews at 4.8 is as good as 50 reviews at 5.0 because like that volume will overcome it.
I think the volume is far more important. I mean, absolutely. And I'll tell you from my experience when talking to, I talk to hundreds of practices every month, and one of the things that when talking about reviews specifically, you have a path to leave a negative review with our system, and I always think it's a really good thing to do because you're going to have patients that may have had a negative experience that need to be able to give feedback, but they're not going to give it to the person that just gave them the negative experience, so they don't have a great alternative to leave negative feedback because really nobody wants to go out to your website to burn you on Facebook or Google. If you're a patient that wants to continue to be a patient, you're not going to go out to those social media platforms to leave a negative review. So this gives a conduit to help improve your practice.
Well, yeah, and you jumped ahead to number 3, which is my bomb diffusal button, right?
Yep.
Which we have in Operatory. So we've got the way to leave positive reviews, Google, Facebook, and number 3 is can we improve informed management? And that is a way for people to give you the constructive feedback like you're talking about, right?
Yep.
You had a temp hygienist that was a little rough, great patient, wants to leave you a positive review, but they want you to know what was going on internally, right? That removes those, the vast majority of negative reviews from, people don't want to scream from the mountains of social media. They don't want to scream the negative stuff. They want you to know so that you can improve, right? Unless there's something else going a little off upstairs, in which case bearing it with positive reviews is the answer. And so I think this is such an important podcast, my friend, that we are going to split it into 2.
Okay.
So I will stop here with the best ways of with just 2 things. The top 2, which is giving an ideal experience and asking people for referral whenever they give you a compliment. And number 2, massive amounts of positive reviews using an automated platform that goes directly through an API link to Google and Facebook like OperaDDS does, while also giving them a way to give you feedback constructively directly to you. I look forward to talking to you for 2 more ways to get massive amounts of new patients to overcome any issue that might be going on in your practice in podcast number 2.
Awesome. Cool.